Hello friends, welcome to GK Academic channel. Now we are going to read about COVID-19 current affairs. The first question is, what is the name of COVID vaccine developed by Bharat Biotech India Ltd in collaboration with the Indian Council of Medical Research, National Institutes of Virology? The options are A. Covaxin, B. Covaxin, C. Covanin, D. Coronin. The answer is B. Covaxin. Explanations are Bharat Biotech India Ltd in collaboration with the Indian Council of Medical Research, National Institutes of Virology, developed India's first COVID-19 vaccine, Covaxin. The vaccine is developed and manufactured by the BSL-3 High Containment Facility of BBIL. The second question is, which company has launched Compact XL, India's first machines to automate the manual process of molecular diagnostic tests like RT-PCR test for COVID-19 on 7th July 2020? The options are A. GlaxoSmithKline Pharmaceuticals Limited, B. MyLab Discovery Solution, C. Panacea Biotech Limited, D. Zydus Cadila. The answer is B. MyLab Discovery Solution. Explanations are MyLab Discovery Solution, Pune, based a molecular diagnostic company, has launched Compact XL, India's first machines to automate the manual process of molecular diagnostic tests like RT-PCR test for COVID-19 on 7th July 2020. The machine was unveiled by Adalat Poonawalla, CEO of Serum Institutes of India. The third question is, world largest 10,000 beds Sardar Patel COVID Care Center is inaugurated in which city? The options are A. Chennai, B. Mumbai, C. Delhi, D. Gurugram. The answer is C. Delhi. The explanations are, world largest COVID Care Center, the 10,000 bed Sardar Patel COVID Care Center, inaugurated at Radha Swami Satsang Bees in Chhatrapur, Delhi. Question number 4. The COVID-19 vaccine developed by Gamalei Institutes of Epidemiology and Microbiology has successfully completed the human clinical trial. The institutes belongs to which country? The options are A. USA, B. Russia, C. Germany, D. Poland. The answer is B. Russia. The explanations are, the COVID-19 vaccine developed by Russia, Gamalei Institutes of Epidemiology and Microbiology has successfully completed the human clinical trials. The trials on volunteers were conducted from 18th June 2020 at Sechenov First Moscow State Medical University. Question number 5. Which of the following is the world most affordable COVID-19 test kit? The options are A. Dermatized, B. Corosure, C. MyLab Swab, D. COVID test kit. The answer is B. Corosure. Explanations are, Sri Ramesh Pokhriyal Nishank, the Union Human Resources Development Minister, and Sanjay Dotare, Minister of State, HRD, launched a low-cost COVID-19 test Corosure developed by Indian Institute of Technology, Delhi. Sixth question. NABARD has provided credit support of Rs 1,607 crore to which state during the COVID-19 pandemic? The options are A. Maharashtra, B. West Bengal, C. Bihar, D. Jharkhand. The answer is B. West Bengal. The explanations are, National Bank of Agricultural and Rural Development has provided credit support of Rs 1,607 crore to West Bengal during the COVID-19 pandemic so far. Question number 7. Which is the first nations to finish human trials for COVID-19 vaccination? The options are A. India, B. Russia, C. United States, D. United Kingdom. The answer is B. Russia. Explanations are, Russia has become the first nation to complete clinical trial of COVID-19 vaccine on humans, and the results have proven the medication effectiveness. The chief researcher Elena Somerchuk, who heads the Center for Clinical Research on Medication at Sechenov University, announced Russian news agency task that the human trials for the vaccine have been completed at the university and they will be discharged soon. Question number 8. Which state announced rupees 50 lakh insurance cover for police personnel and state government employees involved in the COVID-19 fight? The options are A. Kerala, B. Rajasthan, C. Madhya Pradesh, D. Punjab. The answer is C. Madhya Pradesh. The explanations are the Chief Minister of Madhya Pradesh, Shivraj Singh Chauhan, recently announced a rupees 50 lakhs insurance cover for police personnel and other state government employees who are engaged in the fight against coronavirus pandemic. This scheme has been unveiled after 5 health workers and 7 police personnel tested positive for coronavirus in the state capital. The Chief Minister and the Governor of Madhya Pradesh announced that they will contribute 30% of their salary to their relief fund. Question number 9. Which e-commerce firm has launched an exclusive insurance policy to cover COVID-19 in association with ICICI Lombard and Go Digit General Insurance? The options are A. Amazon, B. Flipkart, C. Snapdeal, D. Paytm. The answer is B. Flipkart. The explanations are e-commerce marketplace Flipkart has launched an exclusive insurance policy to cover COVID-19 in association with ICICI Lombard and Go Digit General Insurance. The two health insurance policy which provide instant claim benefits do not require any medical test at the time of purchase. The COVID-19 protection cover by ICICI Lombard provides 25,000 benefit on positive diagnosis of COVID-19 at an annual premium of Rs 159. The cover by Digit Insurance provides hospitalizations cover up to a sum assured of Rs 1 lakh with the annual premium of Rs 511. Question number 10. It has partnered with other ministry and partners to support startups with COVID-19 innovative solutions and to tackle COVID-19 pandemic. The options are A. RBI, B. DRDO, C. AIM, D. Invest India. The answer is C. AIM. The explanations are NITI Aayog flagship Atal Innovation Mission has partnered with other ministries and partners to support startup with COVID-19 innovative solutions and to tackle COVID-19 pandemic. The move is aimed to keep entrepreneurial spirit high across the country as the coronavirus pandemic and economic shutdowns are dealing with a severe blow on the world economy. Question number 11. The Union Ministry of External Affairs has announced a training program on COVID-19 for healthcare professionals of which regional group? The options are A. BIMSTEC, B. SAARC, C. BRIC, D. ASEAN. The answer is B. SAARC. The explanations are the Union Ministry of External Affairs has announced a training program on COVID-19 for healthcare professionals of SAARC country. The Indian Technical and Economic Cooperation Program will conduct this training program from April 17, 2020. The SAARC leaders had virtual meeting on March 15th, where an idea was proposed by India to accumulate the efforts of all health professionals against COVID-19. Question number 12. Who launched the smartphone app Mahakavach to fight COVID-19? The options are A. Pune Municipal Corporation, B. Bangalore Municipal Corporation, C. Nasik Municipal Corporation, D. Chennai Municipal Corporation. The answer is C. Nasik Municipal Corporation. The explanations are Smart City Nasik takes several measures and initiative to fight COVID-19. The measures taken by the Nasik Municipal Corporation launched the mobile application Mahakavach. The app is real-time digital contact tracing mobile application. It enables the citizen to contribute and assist the health authority in contact tracing, geofencing, and tracking of quarantined COVID-19 patients. Question number 13. Which Indian startup has developed a portable hospital unit Medicab, a decentralized approach to detect, screen, identify, isolate and treat COVID-19 patients? The options are A. Modulus Housing, B. Strand Life Science, C. Purian DX, D. MFine. The answer is A. Modulus Housing. The explanations are Indian Institutes of Technology, Madras, incubated startup Modulus Housing has developed a portable hospital unit, Medicap decentralized approach to detect, screen, identify, isolate, and treat COVID-19 patients. It can be installed anywhere within 2 hours by 4 people. Question number 14. Assess Corona is a new application being implemented in which Indian states for containing the spread of COVID-19? The options are A. Maharashtra, B. Kerala, C. Delhi, D. Odisha. The answer is C. Delhi. Explanations are the Delhi government has launched a new application called Assess Corona and has directed its officials to use the new app to conduct door-to-door survey. The survey is carried out in coronavirus containment zones and with the real-time information collected through the app. The control centers can decide quickly if they require ambulance and medical equipments. Question number 15. What is the name of flagship initiative of NITI Aayog to organize the series of virtual COVID-19 demo days to find the potential startups with an innovative COVID-19 solution and to provide support to develop and scale up the solution? The options are Atal COVID Mission, B. Atal Invitation Mission, C. COVID Solution, D. COVID Help. The answer is B. Atal Invitation Mission. Explanation. Atal Invitation Mission, flagship initiative of NITI Aayog, teamed with other ministry and its partners to organize a series of virtual COVID-19 demo days to find the potential startups with innovative COVID-19 solution and provide supports to develop and scale up to the solution. The initiative was launched under the direction of Dr. Vijay Raghavan, Principal Scientific Advisor to the Government of India, and Dr. Vinod Paul, Member of Health of NITI Aayog. Question number 16. What is the cost of Corosure, the world's most affordable COVID-19 test kit? The options are A. Rupees 650, B. Rupees 900, C. Rupees 1250, D. Rupees 1500. The answer is A. Rupees 650. The options are, the explanations are Sri Ramesh Pokhriyal Nishank, the Union Human Resources Development Minister, and Sanjay Dhodri, Minister of State HRD, launched a low-cost COVID-19 test Corosure developed by Indian Institutes of Technology, Delhi. The total cost of kit is around rupees 650. It can be do 2 million tests per month. Question number 17. Which among the following are the short-term standard health policy mandated by IRDAI for insurance company? The options are A. Corona Kavach, B. Corona Rakshak, C. Corona Batter, D. Both A and B. The answer is both A and B. Corona Kavach, Corona Rakshak. The explanations are Insurance Regulatory and Development Authority of India made it mandatory for all general and health insurance to launch the short-term standard health policy for coronavirus disease, which Corona Kavach and Corona Rakshak, due to rapid increase in the COVID-19 case in India. Notably, the premium under both the product shall be the pan-India basis and no geography locations or zone-based pricing will be allowed. Minimum entry age for both the policy will be 18 years and the maximum 65 years. Question number 18. Neela Satyanarayanan, first human state elections commissioner of which state died of COVID-19 on 16th July 2020? The options are A. Maharashtra, B. Gujarat, C. Karnataka, D. Tamil Nadu. The answer is A. Maharashtra. The explanations are Neela Satyanarayanan, first woman state election commissioner of Maharashtra and a praised Marathi author, died of COVID-19 on July 16, 2020. She died at Seven Hills Hospital at Marur in Andheri East, Mumbai, where she was undergoing treatment for COVID-19. Question number 19. Who developed the world's most affordable prop-free reverse transcription polymerase chain reaction based on the COVID-19 diagnostic kit? The options are A. ICMR, B. AIIMS, C. CSIR, D. IIT Delhi. The answer is D. IIT Delhi. The explanations are Sri Ramesh Pokhriyal Nishank, the Union Human Resources Development Minister, and Sanjay Dhotri, Minister of State HRD, launched a low-cost of COVID-19 test, Corosure, developed by Indian Institutes of Technology, Delhi. Corosure is billed as the world's most affordable free reserve transcription polymerase chain reactions based on the COVID-19 diagnostic kit. Question number 20. Which institutes have developed the disinfection box unisaver box, which can be used to sterilize various personal belongings to minimize the COVID-19 transmission? The options are A. Indian Institutes of Technology Indore, B. Indian Institutes of Technology Patna, C. Indian Institutes of Technology Roorkee, D. Indian Institutes of Technology Bhubaneswar. The answer is C. Indian Institutes of Technology Roorkee. The explanations are the Indian Institutes of Technology Roorkee announced that IITR research team led by Prof. Soumitra Satapathy Laboratory of Integrated Nanophotonic and Biomaterial have developed the disinfection box unisaver box, which can be used to sterilize various personal belongings to minimize the COVID-19 transmission. Question number 21. Which institutes of CSIR introduced the COVID protection systems for workplace? The options are A. Central Mechanical Engineer Research Institute, B. Advanced Material and Process Research Institute, C. Central Electrochemical Research Institutes, D. Central Electronic Engineering Research Institutes. The answer is A. Central Mechanical Engineering Research Institutes. The explanations are Council of Scientific and Industrial Research, Central Mechanical Engineering Research Institute, Durgapur introduced the COVID protection systems, a collection of technology for workplace which includes a contactless solar-based intelligent mask, automated dispensing, unit cum thermal scanner, touchless fax, and 360 car flusher. Question number 22. The IIT-Alumni Council signed an agreement for joint research on COVID-19 and patients' data analysis with which institutes? The options are A. CSIR, IICT, B. CSIR, CMERI, C. CSIR, IGIB, D. CSIR, IHBT. The answer is CSIR, IGIB. The explanations are the Aluminium Council of India, Institutes of Technology signed an agreement for joint research on COVID-19 and patients' data analysis with the Council of Scientific and Industrial Research, Institutes of Genomic and Integrative Biology. Question number 23. DAS unveiled the COVID protection system for workplace. The options are A. DRDO, B. CSIR, C. SCTIMST, D. MyLabs. The answer is B. CSIR. The explanations are Council of Scientific and Industrial Research, Central Mechanical Engineering Research Institute, Durgapur unveiled the COVID protection systems for workplace to tackle the COVID-19 pandemic. Apart from the healthcare worker, the frontline security guards of any organizations are very vulnerable to COVID-19. through infected individual and contaminated objects. CSIR, CMERI have announced that it is to develop a digital entry in which the workflow will automated based upon artificial and integrated things. Question number 24. Which state organized India first e-Lok Adalat to ensure that administration of justice and to solve the financial crisis of the parties and lawyers amid COVID-19 pandemic? A. Bihar, B. Chhattisgarh, C. Gujarat, D. MP. The answer is B. Chhattisgarh. The explanations are: on 11th July 2020, Chhattisgarh State Legislative Service Authority and the High Court organized India First e-Lok Adalat to ensure the administration of justice and to solve the financial crisis of the parties and lawyers amid COVID-19 pandemic. Question number 25. Which state government announced a monthly pension for the family members of ASHA and Anganwadi workers who succumbed to the COVID-19 virus during active deployment? The options are A. Rajasthan, B. Odisha, C. Gujarat, D. Telangana. The answer is B. Odisha. The explanations are: the Odisha government on July 17, 2020 announced a monthly pension for the family members of ASHA and Anganwadi workers who succumbed to the COVID-19 virus during active deployment. The state will provide the spouse of next kin of deceased Anganwadi worker who succumbs to COVID-19 in line of duty under active deployment with rupees 7,500 per month till the date they would have attained the age of 60 years had they survived. If you like my video, please subscribe my channel, press the like button and share to your friends. Thanks for watching.